I'm Jessica with Harmony Pilates and Physical Therapy. I'm a physical therapist and Pilates instructor, and we're just going to talk for a few minutes about your abdominal muscles and your pelvic floor. So you have 4 sets of abdominal muscles. You have your rectus abdominis, that's your six-pack. Runs basically from here all the way down to your pubic bone. It causes trunk flexion. So you've got your obliques, internals and externals. So that causes your twisting action. And then you have your lower abdominals, your transversus abdominis, which basically acts like a belt from your belly button to your pubic bone that runs all the way around into your low back. So it's your main stabilizer when it comes to your abdominal muscles. It works to pull the belly in, stabilize your trunk, and it works in an anticipatory fashion, meaning when you think about taking a movement or taking a step, that muscle kicks in to help control and stabilize your pelvis and your low back. Then you have your pelvic floor muscles, which literally act as a harness, or a hammock we call it, like a bowl, and it helps to lift up your organs. So we're going to talk just a little bit about how to properly contract those muscles, and it's a great exercise you can do throughout the day. So the easiest place to start is to lay down on your back. You can do these sitting, but we do like to start people on their back. It's the easiest way to find them. So starting on your back, I want you to find your neutral spine. You should have just a little bit of space here in your low back, and you should have a flat pelvis here. So you don't want it curved towards you or tilted away from you. So if you place your hand flat between your pubic bone and your belly button, it should be parallel to the ceiling and the floor. So we're going to start here, and what I want you to do is take a big inhale through your nose. When you exhale, I want you to draw your belly button towards your spine. Feel like there is an orange between your belly button and your spine, and you're trying to squeeze out the juice. And then relax. Let's do that one more time. Inhale and exhale. And what I want you to notice when I do that is I'm not squeezing my buns and I'm not flattening my low back. So to get my arms out of the way, it doesn't look like this. You're not going to squeeze and tilt as hard as you can. So basically, again, inhale. Exhale. So I'm keeping the space in my low back. I'm keeping this part flat so my pelvis doesn't move, and I'm just drawing in. And it's about 50% effort. You're not squeezing as hard as you can. You're not squeezing your buns. You're not flattening your back. Okay, that's the key to transversus contraction. Then if you add the pelvic floor, what you're going to do is, again, pull that belly button in, and at the same time do the action of stopping the flow of urine. So that's what we call a Kegal. And that's going to help lift that pelvic floor. So to do it all together, you're going to take your big inhale. Then exhale, draw belly button to spine and draw that pelvic floor up, almost like they could meet. And then inhale and relax. So exhale, belly button in, pelvic floor lifts. Inhale to relax. Exhale. And you can continue these throughout the day. So if you're doing them as an exercise, I would recommend about 20 in the morning when you wake up and 20 at night before you fall asleep. And then think about doing that throughout the day. When you're in the car, every red light you hit, do those exercises. Every time you're in line at the grocery store, practice your exercises. And then as you progress, you can work to doing them sitting as well. Take your inhale and exhale, belly button to spine, pelvic floor lifts here. And then as you progress from there, you can start to do them throughout the day with your exercises. You can do them as you squat. So it's just that idea of thinking gently of belly button to spine, pelvic floor lifting. It should increase your posture, and it's going to help you over time use your low abs efficiently and help you strengthen your pelvic floor.